Welcome to the Transforming Healthcare Coaching Podcast, where we bring you guidance and coaching perspectives so that you can level up in your life and work. So welcome everybody to Transforming Healthcare Coaching Podcast, and we're super excited for today's topic, which is about self-care strategies and how in the world do we realistically, in this day and age, implement self-care routines that prioritize our mental, physical, and emotional well-being. So Klaus, I'll turn it over to you actually, if that's all right, because I know you have such passion for these topics, to go ahead and lead us in the discussion, because rarely do you get all five of us. And so you guys should get all five of us on this podcast today.
Sure. So I guess I'll pose it to the group first, maybe some questions, and we'll bounce back. So from your guys' perspective, what are the most common self-care challenges you find that healthcare professionals face and how they can address them effectively?
Time is always a big constraint that we all have, right? So there's a thought that if I'm going to self care and do something, this routine is going to take me a really long time. I've had a routine that I've done on and off over many years that literally can take 2 to 3 minutes that I do in the morning. That is a game changer for me. And just those 2 minutes has really helped me in my body and how to, one, it helps me give me energy for the day. I think it's helped my joints over the years. And this belief that I don't have time, which I get into sometimes to not do that, it just blows up in my face.
I think time's a huge one, Amy. And we've talked about this in several episodes, is that time is a huge barrier for people to start to say, hey, I need to start taking time for myself, whether that be self-care, whether that be relationships and things in our everyday lives. And I will piggyback on that. That's a big thing, or was a big thing for me, was time for my self-care, saying that, oh, no, I don't have enough time. I have to go to work in the morning, or I have to go to work in the afternoon, and I need to focus on resting before my shift. Whereas I realized that was just a obstacle that I placed myself. But to really say, hey, no, in the mornings, I can wake up earlier and do a little jog, or I can go to bed a little bit earlier and have more time for myself to do the things that I need to do to kind of refresh.
Yeah, for me, I think it was the pandemic and actually my fellows, people who are much junior to me, to actually tell me, oh, yes, you can prioritize exercise. Oh, yes, you can do the right things for your mental health. And oh, look, I'm also plant based and I'm wonderful and pack all my meals. And I was like, oh, I need to level up my game because of people who are 20 years junior to me actually doing all the right things in the pandemic. And so for me, it was my sort of realization that if someone else can do it, then I can too. And so I think people don't really realize how much of being a good role model is really important, of just doing and talking about the right things that they do and being unapologetic about it.
And one of the things I've seen is uh, healthcare professionals who have families to look after. They might have young children at home. And I was in that situation myself. And I felt pulled in so many different directions. And it's juggling priorities. It's dealing, not feeling guilty or feeling guilty about taking time out of kid activities because you have to be at work. So I feel like that's a big one. And there's a lot of people with children working in healthcare. And so I feel like that's a big drain on certain people.
Yeah, I agree with everybody. It's time. And I think it's just that creating that time or those spaces to also schedule. Like this is the boundaries, right? The family no touch zone or my personal no touch zone or kind of thing to say, of course, there's always going to be emergencies, especially when we are working in the front lines. It's okay, I have to take care of this. Is it in alignment with my values and all? And that way we can rearrange, but not having that every day taking over the schedule.
And I think the other hard thing in healthcare specifically is that we are willing to role model that it's okay to have our boundaries stepped all over. And it's very easy to be disliked for having normal, healthy behaviors. It's like in terms of when you set some limits, I'm sorry, I just can't. In terms of some limits with either a project or coming in early or taking more overtime. In the group, it can be this silent bullying that occurs within certain work groups where you never volunteer or you don't actually contribute more to the team. And so there's an unspoken rule in healthcare where we don't reward the people who are actually upholding their boundaries for health, which actually allows them to show up more happy, more positive at work.
So what I'm hearing from a lot of all of us saying is that self-care for many healthcare professionals can feel like guilt and selfish in ways that really shouldn't, because we have to be able to show up for ourselves if we want to show up for others. So I guess this leads me into this next question is, what are some of these misconceptions about self-care that healthcare professionals should be aware of?
Let's start with as far as what you just mentioned too, Klaus, about being selfish. I bring this up in just a lot of my coaching interactions and especially with parents, right? So I say, let's look, what is the actual definition of selfish? So it's lacking consideration for others, concerned chiefly with one's own personal profit or plethora or pleasure. And that is not it, right? If we take the time to care for ourselves, that just opens up so much more creativity or possibilities for us to be able to care for not only our families, but also our patients, especially in being in the mental health or critical care areas, that it literally is important to be able to think quicker and to be more present.
Yeah, and that reminds me, Griselda, of that saying where you can't pour from an empty cup. We have to look after ourselves in order to be able to care for others.
And also that it takes large amounts of time and we can sprinkle it in throughout our work days. I remember when I was in a imaging center and I chose to always take the room furthest away from where the computers were. So I got in so many steps. I didn't have a step counter back then, but I'm sure I walked miles. And just that time that I walked to the really far room and moved my body and said hello to the people along the way, it was like a break for me. So just integrating in whatever way you can, whatever brings you joy and movement and taking care of yourself, finding your own way and integrating it throughout the day. And then it adds up, even if it's a minute here or 5 minutes there, and doing it regularly.
And I think for me, it's also the mindset of the self-fulfilling prophecy of you telling yourself that you don't have the time and that you're not going to do it just becomes real. And the question is, how can you change it so that you can say, I am going to do something small? And to piggyback off of Amy's, I usually tell people, you have to go in the car. You probably have to hand sanitize. You probably have to wash your hands. Those are 3 minutes, right? 3 little minutes where you can just take a moment, and if you start to make a new habit, no one even knows you're doing it. And you're double dipping, and you're also proud of yourself because "I did it."
I love these little strategies that healthcare workers can actually do to really actually start to implement self-care into their professional lives. So I guess that actually goes into the next question is, how can healthcare workers balance the demands of their profession with their self-care needs without feeling guilty and overburdened and feeling like they can only do that at home?
What's coming to mind for me is just thinking about the win, that it's going to work out in the end if I do take that time for myself. If it's let me find that little corner and prep for my patients, or let me do this at home. If it's going to speed me up at work, then I'm going to be able to come home quicker. And if it's just vice versa. So I think it's looking for those opportunities and how do we synergize so that we can move forward.
Say, get a coach. Hit the pause button. Notice what your thought patterns are, that you even feel that guilt or you feel that mindset that you don't have the time. That's what this work has been so magical for us and really effective in helping to really choose how we respond to things. And like I said, hitting the pause button. We're a great avenue to help put awareness on that.
I think the COVID pandemic really taught us that we really do need to actually be well, and we actually need to come in and not accidentally be a vector that carries more COVID around the healthcare system. And so I think, thank goodness, in some ways for the pandemic, because hopefully that attitude is not changing across different work groups in terms of coming in sick and having other support systems for employee assistance programs and other opportunities where even in our workplace, we often now have mindfulness and yoga and 30-minute breaks, massage chairs, food, water. I don't know about you, but hopefully your healthcare system actually has tried to do small things. And I get it. It's not, the pizza parties are not the only thing that actually is helpful. And at the same time, at least there's now attention towards how can we actually make the workplace at least slightly more sustainable with break rooms or gardens or places that we actually can get our steps in and actually try to be a little more healthy along the way. And the choice becomes you can choose to be guilty feeling whenever you're asked to be picking up another shift or doing something for somebody or someone you don't want to do. The choice to feel the guilt and immerse yourself in it. It's another choice to say, not today. Doesn't mean tomorrow you won't be able to be helpful, right? The opportunity will come again where you can help the team. It's just that not this week. I'm sorry. Maybe next month. If there's a call off, I can help you this time.
And with COVID, everybody has become so much more comfortable with Zoom or other platforms. And I feel like that helps us reduce the amount of time we spend in person meetings. It makes meetings and things like that more accessible, but also from a personal point of view, we can get yoga classes online. We can get even strength classes and we can have instructors work with us. So perhaps we can't get to the gym, but maybe we can do a workout at home online.
I love that. And I love the idea of thinking of self-care imposed by our healthcare organizations, right? You can think of it that standpoint and saying, my hospital network, they don't provide us with a gym, they don't provide us with this, so I can't prioritize my health. And this is something I always empower my own clients, and actually, I think even to my own patients, is to take charge of your own health. Nobody's gonna be able to give you the answers that you have within, and that has to come from you, and the actions are only done by you. And self-care doesn't have to be reserved just for home. Self-care can be at work. And I think of this just now. How many times do I go into an ER shift and then all of a sudden there's 30 in the waiting room? People's are running off, chicken with the head cut off, right? And it's so easy to say, okay, I'm going to help clean out this department. I'm going to go ABC really quick. And I'm like, you know what? Why am I getting this adrenaline rush that may cause me to make a mistake or make me feel overwhelmed and guilty? I'm going to see the next patient, give them the care that they deserve, have a conversation with them, tell them I'm sorry for the wait, whatnot, and really feel gratitude that I'm able to do that. And then just remember, we are triaging based off emergencies and acuity, and to take that deep breath. And there's nothing wrong with that. And there's nothing wrong with you're feeling overwhelmed, taking a breath of fresh air, or walking out the ambulance bay for a quick second, which is something I do a little bit more frequently now, and it helps you refresh and kind of restart. And in that essence, that's self-care. And it's not selfish because it makes you a better provider and a better team player and better able to tackle the next task at hand. So those were great topics that you guys talked about. Thank you. So I'll move on to our next question. Can we discuss any specific self-care strategies that have been particularly effective for our clients, managing stress and preventing burnout that maybe can be incorporated when it's a busy day?
One I've seen pretty successful with not only myself, but working with clients, especially in healthcare, is just that hand on the door or on the knob, right? That it's before I go in just to take a quick breath. And sometimes I find myself with some difficult families or interactions is just to take that mental breath. I don't have to do anything, but it's still just taking that breath and knowing, okay, what's my purpose? When it's like wherever you reach for that spiritual influencer to say, okay, this is why I'm here.
I like that you mentioned the spiritual influencer because I think it's so easy when you're in work that you're focused on the task at hand. There's so many patients. I need to get in and out. I need to make sure my team is at its highest performance. And I think it's so easy to be so task oriented that you forget that these are people's lives, these are patients. But at the same time, this is why you went into medicine. You weren't into medicine to make money, which obviously comes with it, but you went into it for helping others, whether the underlying reasonings is different for everybody, but to remind yourself that there was a reason you went into this and that you feel connected to people and to not really lose that connection. And that to me is self-care as well, is that reminder of why you went into medicine, why you're doing what you're doing, and to always prioritize the patient.
Getting back to your question of what kind of specific strategies different clients that in healthcare have used, I think is actually really prioritizing something at the beginning of the day with the right intention. For certain executives, it really has been taking that 15 minutes for themselves to not scroll, doom scroll on their phone when you first wake up and the morning breakfast and do all the data input, is to actually just put that aside and actually do something for themselves, whether it be the meditation or actually do the deep work they need to do. For example, they have to really get a particular presentation or a briefing done. So really just to give themselves, I think most of the people have just chosen 20 to 30 minutes. And so I think it's really hard to get up a whole hour early. It's hard to actually work out at 5 in the morning for some people. I can't work out at 5 in the morning. But it's possible to do 30 minutes of something else that actually can fill your cup. And so not having to conform to other people's standards and just figuring out for yourself with intention. And then once that habit starts to get formed, you get really proud of it. As with accountability of being the coach client relationship, they're like, I did it and I did it again. And then they're like, they notice that the rest of the day goes smoother because they at least accomplished the most important thing that they want to get done, whether it be reading the thing they need to read, work on the paper they needed to write, or meditate or gratitude, like whatever it is they want to work on.
Like how you mentioned self-care in the essence of prevention, just preventing yourself from going on the phone first thing when you wake up in the morning. And then I like the idea of just one small task. And I think that's something I think we all see in our clients is one small task in the beginning, one baby step. And that could be reading a journal, listening to a podcast episode in the morning right before your shift to work, even if it's really early in the morning on your drive to work, something like that. Incorporating one small strategy into your self-care can transform the rest of the day. I love that.
One of the things that I've found helpful is to have people switch off notifications on their phones that are not necessary. Obviously, in healthcare, there's a lot of messages coming across that are absolutely crucial, but there's some that are not. And if we get rid of those distractions, it helps keep us focused on what we're doing. Other thing that I've found with clients is they'll say, I have a whole pile of books I want to read. I'm not able to get through them. So sometimes an app like Blinkist, where it gives you the short version and you can listen to it versus reading the whole book and you can get the main points. Sometimes that's very helpful. And you can always read the full book if it's a topic that you're really interested in. That's a couple of things that I've found useful.
I think a lot of my clients in healthcare also have this worry about whether it's project delivery, but it's also learning for themselves. So I think there's just so much information for to keep up on in general, and so many mandatory things to do. Is to also just make that bite size as well, Klaus. Just like you had said, that just doing one small thing and just being, we did it. So just trying to also make it bite size, which is why we obviously have used the podcast as our primary way of getting out information because you're listening, you're driving, you're walking, it's the easiest way to consume information is just listen and go shopping, listen and do something else. And so to be okay with just doing small tidbits to help with your learning and to hear things again and again. And so we know from learning science that you do need to see and hear something multiple times and that by tomorrow you've already forgotten over 50% of what we just talked about during this podcast. And so you may see us actually repeat some of the content again for this reason.
Some people, that one small step might be unknown or unforeseen. And that's something like I'll give a quick tidbit to what Amy mentioned earlier that sometimes coaching can help with is helping find out what it is self-care means to you and how to obtain that in your own life and have a visualized roadmap that we can help create for you is often very helpful. And so if that resonates with you and self-care is something you're looking to prioritize and need some help, please book a discovery call with one of us. And so I guess I'll close this episode on that and ask, does anybody have any further advice you'd give to somebody who's struggling to prioritize self-care in our healthcare world?
I'd like to just bring out a little challenge as far as if you are listening, you say, you know what, I want to try to find a different way to care for myself. Is just try something and just see how do you feel at the end of the day? How do you feel at the end of the week? And just reflect on it and see, I could find more time to do this, or I want to try something different instead. So I challenge each and every one of you.
I think the biggest hindrance that we often do for ourselves is the fact that we pick a huge goal. I want to lose 50 pounds. So, how about we just walk every day for 15 minutes and just use smaller goals and then incrementally make the goals bigger? I think the reality is that often we stagnate wherever we are and we think, oh, we're cruising, things are good. And then the reality is do one small thing. And then with one small thing becomes the next small thing, which is why you'll hear a lot of people talk about the 1% better or the 10% better. That's all you really need to do to be able to get where you want to go.
Perfect. Thank you guys.
Thank you so much for listening to the Transforming Healthcare Coaching podcast. If you found this episode interesting or useful, please share it with your friends and colleagues in healthcare. and we would love it if you hit subscribe so that you never miss an episode. We want to help with the topics and problems that you want us to talk about. Leave us a review wherever you listen to us with suggestions, feedback, and praise. It means so much to us, and we actually read every comment. For deeper support in your life and work as a healthcare professional and leader, head over to transforminghealthcarecoaching.com. Download our free 5 reflection questions to jumpstart your journey and join our email list to be the first to know about our coaching programs. We're also excited to offer the MedThrive community, a supportive space for group coaching and self-paced personal growth, providing an alternative path to growth beyond one-on-one coaching programs. Find out more and join this thriving community at transforminghealthcarecoaching.com. Together, we can transform healthcare, one person at a time.